welcome to Capitol Hill. We have Congressman James McGovern with us from the 3rd Congressional District. This is your 7th term?
Correct.
Which is, what, 13 years now?
Yep, 13 years.
That's just incredible that that much time has gone by and you've served our district so well.
Time flies when you're having fun.
Oh, yeah. And the district is so big. You represent from Leominster?
No, I go from Princeton to Worcester to the Attleboro's, obviously I have Shrewsbury, down to Fall River.
Fall River. Yeah. So you have a lot of area to cover. From what I understand, I work in a different county than what we're in right now, and you represent them just as well as you do Worcester County, which I assume if you do that, then it must be the same throughout.
Right. Well,
how do you cover that territory?
Well, it's not easy, but you know, I do a lot of driving and a lot of listening, and but it's an incredible district. It's very diverse. I have urban areas and suburban areas. I have areas that are doing extremely well and areas that are being challenged right now with this economy being in facing these difficult straits. But I love the job, and I wouldn't be here if I didn't love it. It's a lot of work. It's a lot of sacrifice on your family, but public service is something that I think is an honorable profession, and I think I'm making a difference. So I'm still here.
Well, for me, thank you. Vice Chair of House Rules Committee, very powerful position.
The Rules Committee is the traffic cop of Congress. Every bill that goes to the House floor goes to the Rules Committee. And Rules Committee can decide debate time, whether the bill can be amended, or sometimes it could rewrite the entire bill. But I'm on the Rules Committee because my former boss, the late Congressman Joe Moakley, was the chairman of the Rules Committee. And when he was ill and dying, he wanted to make sure I took his seat, because Moakley took Tip O'Neill's seat. When Tip O'Neill was on the Rules Committee before he ran for leadership. So Moakley wanted to keep it in the family. But it's a great committee to be on because you get to have your hands in everything.
Now, it's interesting that you mentioned Tip O'Neill and Joe Moakley. They were both from the Boston area, but yet we felt very well represented by them also. So I think that just proves that you can represent your district very well, and your record has proven that.
Well, both Moakley and Tip O'Neill were both heroes of mine. I mean, they were in this business for all the right reasons. They didn't want to be president of the United States. They weren't trying to, further their ambitions. What they were doing is what they loved, and that was helping people. Whether it was finding a Thanksgiving turkey for Mrs. O'Leary if she didn't have enough to pay for a Thanksgiving dinner, or whether it was tracking down, a veteran benefit for somebody who served in one of the wars. They were all about helping people. Politics was about helping, not just, it wasn't some just abstraction. It was about helping people one-on-one.
Now, we'll get into these other topics later, but you really do champion the underdog. You champion the poor and the hungry, and I admire you for that. How do the working class people know that you've represented them? You've also done other work, certainly representing the working class people, and you have always been there for, I know, my town. When we need something for our town, you're there. Tell us a little bit about how you spread yourself to represent all.
Well, I mean, look, my view is that the Donald Trumps of the world don't necessarily need government as much as somebody who's struggling. And that's not only the people who fall into the category of being poor, but a lot of working class, middle income families are struggling harder today than at any other time in their lives. I mean, people are working harder and longer and getting less in return. And so, I mean, where my heart and soul is in the Congress is with working people, making sure people have jobs. I mean, I've been fighting to try to not only on a national level provide more funding to help stimulate new jobs, but also working on an individual basis with cities and towns, trying to help bring new businesses and new companies into our area to create more jobs. I was yesterday in Marlboro. We get some stimulus money for this company called IQM, and what they're developing is this new technology that will allow hospitals and doctors to streamline the whole process of testing your blood. Rather than going and getting all these vials taken and sending them off to a lab, This is a machine that with a little slab of your blood can do all the testing, in less than an hour in the office, so it doesn't have to be sent away. So it will provide more accurate results quicker, and it will probably be ready to go to market in the United States by the end of the year, creating hundreds of new jobs. They get the stimulus money to help advance their research. They hired another 9 people. They told me another several dozen more will be hired by the end of the year. And then once it hits the market, it's going to be hundreds of jobs. Those are the kinds of things that I'm focused on. And the types of jobs we're talking about are not just triple PhD jobs, but there's a manufacturing component to this, to build this machine. There's a sales component to this, to people go out and market this stuff. So it's a very diverse job, a pool that this will create. So my 3 most important issues are jobs, jobs, jobs. I think that the way the state gets out of this mess that it's currently in is by getting additional revenue. How? Through more people going to work. The more people working, the more people that pay taxes, the more that the state will be in a fiscally sound shape. We don't have to raise taxes, but the fact is that with all these people out of work, it's taken a severe toll on our state and our local budgets.
Okay, so in talking about jobs, and you talk about the diverse types of jobs,
right.
What are some other types of businesses that you have either brought already to the industry or that you have on the horizon?
Well, I always ask the question, what are we going to be making here 5 years from now? And when you answer that question, then you kind of, move backwards. I think, in this area here, we, the life sciences, the medical profession has been kind of the key engine for job creation. I mean, UMass is the biggest employer, in our area, and we have this, burgeoning biotech industry, and I think, like the example I just gave you with IQM, I think that there's great potential there, for more jobs if we invest properly. The other area I think is in the area of environmental technologies. We're finally and thankfully getting more concerned about global climate change and about our environment. And as a result, I think there's all kinds of opportunities for us in the area of fuel cell technology, in the area of solar energy and wind energy. This is the home where basically where we're standing now, sitting now is the home of the Industrial Revolution. Why not have a second green revolution here? Why can't we fill up these vacant factories with manufacturers to build, the new engines and sources of energy for tomorrow? We could do that, and I'm working with, various businesses and companies and local governments to try to figure out a way to make sure that we are the recipient of those jobs. I have no doubt they're going to be created. The question is, are they going to be created here in Massachusetts, or are they going to be in North Carolina or Texas or California? I want them here. I think we have the brain power. I think we have the infrastructure. I think this is a good place to live. I think we have the universities and colleges. We have the vocational schools. We have great public schools here. Shrewsbury has one of the finest public schools, I think, in the country. This is a good place to live. This is a good place to train the workers of tomorrow, and we should be aggressively trying to get those jobs to come here. Okay,
so you've mentioned healthcare. There's certainly an awful lot of discussion about healthcare and insurance in Washington. And what my friends always want to know is how it's going to affect them. And the bill is so huge. How will healthcare insurance reform affect us?
Well, the political climate has become so polarized, I'm not sure what is possible. I'm hoping that we can get health insurance reform because I think it's important. And let me tell you why. One is average families and businesses are seeing their costs and premiums go up, by astronomical amounts on a yearly basis. Cities and towns, when I go to talk to the Board of Selectmen or City Council, the first 2 things they talk about are the high cost of utilities and the high cost of health care. They have to pay for all their municipal employees. We have to figure out a way to control these costs, which are out of control. There's no question. I mean, I guess if somebody believes that it's fine to see your bills go up 10, 15, 20% a year in some cases, then we differ. But I think we need to control costs. Secondly, I think we spend an awful lot on healthcare already. We spend more on healthcare than any other country in the world, and I don't think we get the biggest bang for our buck. You know, the infant mortality rate in Cuba is better than it is here in the United States, and life expectancy in the United States, we rank behind Bosnia. I mean, for all the money we're spending, we ought to do better. And part of the problem is our healthcare system is focused on treating you when you're sick, not on how to keep you well. Look, we want to make sure we have the best heart surgeons and brain surgeons to treat you when you are sick. But boy, wouldn't it be better for you, and wouldn't it be cheaper if we could put a little bit more emphasis on prevention? And one of the things we're trying to do is, get rid of all the copays for preventative care. No one should have to wonder whether they should get a colonoscopy or a mammogram or any other kind of preventative test because there's a copay involved. So that's another aspect of what we're trying to do. The other thing is we're trying to figure out a way to help seniors deal with their drug costs. We've talked about eliminating the prescription, the donut hole in the prescription drug program Part D, so the seniors don't have to worry if they reach a certain point that they're going to have to assume the cost of their prescriptions. And look, and people need to have peace of mind, knowing that if you get sick, that you will be taken care of. You know, the casework that I deal with in my offices really is not people who don't have insurance. We provide people, we mandate insurance here in Massachusetts, but it's when people get sick and all of a sudden they're told, this is not covered, this is not covered, this is not covered, and then they call us and saying, you have to go and fight with our insurance companies. If you pay for insurance, you ought to be able to get it. And the final thing is that we need to understand that what we've done here in Massachusetts is a good first step, mandating coverage. But there's a whole bunch of other states that don't do that. So we're doing the right thing here in Massachusetts. The other states are not doing the right thing. And guess what? We're all paying for that. For example, the 25-year-old guy in Texas who goes for a job and is told, you know, here's what you're going to get for pay. And if you want us to take health insurance out, this is what your paycheck will be. Or you can keep the money and do whatever you want with it. Guy's 25. He says, hey, I'll keep the money. I'm going to live forever. Then he goes out on a camping trip and gets bitten by a tick and gets Lyme disease or something. And he shows up at a hospital. He gets treated. And he will be taken care of. But the cost of that care will be uncompensated, and it will fall on the taxpayers. And we are part of the national tax-paying base here in Massachusetts, and we will be forced to pay for that. It makes no sense. And what we don't pay for goes on to our debt. And one of the biggest driving costs for, in terms of our debt is uncompensated health care. So, for a whole bunch of reasons, we need to get this right. No, what you have right, I mean, the premise is if you like what you have, you keep it. But what we're saying is I think we could do better. And what's wrong with that? And I understand people have been inundated with all kinds of misinformation, and there's been a lot invested by the insurance industry to scare people, and talk radio has maligned healthcare. But here's the deal: 40 million people in this country don't have health insurance, and you know what? We're all paying for that. Doesn't make any sense to me.
So basically what you're saying is we're paying anyhow.
We're paying anyhow.
So we should do it in a way where it takes care of all of us.
Understand one thing: the poorest of the poor in this country have Medicaid. Mm-hmm. So I mean, I go to these, when I've been at a couple of forums, people say, oh, we can't take care of the poor. We do. We have Medicaid for the poor. It's those people that are, too rich to qualify for Medicaid and above. Some of those people are going to need a subsidy to be able to afford health care, health insurance. There's a big chunk of those 40 million people that are perfectly able to afford it, but choose not to get it. Those people ought to be told that they have to have insurance. You need car insurance. You ought to be required to have health insurance in this country. And that's the way it is here in Massachusetts. It should be that way all around the country. And I think we will see, and the Congressional Budget Office has shown that if we do this, we're going to actually save a boatload of money and be able to, reduce our deficit by a significant amount over the next 10 years. But look, if people have better ideas, I'm all ears. Mm-hmm. What I think is unacceptable